अस्सलाम वालेकुम व्यूवर्स। आज के हम इस वीडियो में बात करने वाले हैं मैग्नीशियम टेटानी के बारे में। तो पहले हम पढ़ेंगे कि मैग्नीशियम टेटानी के सिनोनिम्स कौन से होते हैं और मैग्नीशियम टेटानी होती क्या है, और उसके बाद मैग्नीशियम टेटानी की एपिडेमियोलॉजी, डायग्नोसिस, ट्रीटमेंट एंड क्लिनिकल एस्पेक्ट्स के बारे में कंप्लीटली बात करेंगे, इंक्लूडिंग द पैथोजेनेसिस ऑफ मैग्नीशियम टेटानी। So let's start our lecture that what is magnesium tetany. First of all, magnesium tetany is also known as grass staggers, grass tetany, wheat pasture poisoning, or copsic, hypomagnesiemic tetany, or winter tetany. So these are the synonyms of magnesium tetany. Now what is tetany? First of all, we should know that tetany refers to muscle cramps, spasms and tremors, as usually happens in the tetanus of the horse or other animals. Now specifically, magnesium tetany is a disease of magnesium metabolism in ruminants, affecting goat, sheep and beef and dairy cattle in all countries of the world. So magnesium tetany basically is a metabolic disorder. Magnesium tetany is characterized by signs of excitability, muscular tremors, grinding of teeth, excessive salivation, ataxia, recumbence and tetanic muscle spasms, frothing at the belly and kicking of the belly. These are the clinical signs in an animal if magnesium tetany exists. Here, an important point to note is that recumbent animals with frequent seizures and opisthosis die within hours, in many cases before treatment can be administered. So these signs should be prevented at the early. So let's discuss in detail. First of all, to better understand the magnesium tetany, we should know the normal physiological mechanisms of the magnesium. That what are the main functions of the magnesium. Magnesium is a mineral element and it acts as an enzyme activator. For example, in ATPase, kinases and phosphatase enzymes, magnesium works as an activator. And magnesium is also used for the synthesis of DNA, RNA and proteins. It also used to regulate the mechanism of the membrane channels by aiding in the transportation and modulate the synaptic transmission in the nerve impulse. And then how the magnesium is absorbed from the animal stomach. From the cattle and sheep, magnesium absorption happens in the rumen, while in lambs and calves before weaning from the large and small intestines. And the shift of magnesium absorption from the intestine to the forestomachs is correlated with the change in diet from milk to conventional diets like concentrate and roughages. Distribution, metabolism and excretion of the magnesium. Distribution, according to research, 60 to 70% of the magnesium is distributed in the bones, while 30 to 40% in soft tissues. About 1% found in the extracellular fluid, and there is 2 to 3 grams of the magnesium is found in the extracellular fluid of a cow. Magnesium concentration in extracellular fluid depends upon the absorption of the magnesium, endogenous secretions and excretion via the kidney. And if we talk about the metabolism and excretion of the magnesium, no hormonal regulation of the magnesium takes place during the metabolism, while magnesium is excreted from the kidney. Most of the ultra-filtrable magnesium, around 80%, is reabsorbed from the proximal convoluted tubule and distal convoluted tubules, and also from the collecting duct, while only 3 to 5% is excreted in the urine discharge. Now this is an overview of the magnesium physiology. Here, if the intake of the magnesium is lesser than the fecal output or the urinary excretion, then the magnesium tetany develops. Because of magnesium role in many physiological functions, its depletion can cause disturbances which have serious consequences such as depression of the voluntary feed intake, milk production reduction, and death may occur when hypomagnesemia leads to tetany. Now let's come to the pathogenesis of magnesium tetany. Pathogenesis is not always associated with magnesium deficiency. It may occur due to lack of the hormonal regulation of magnesium. While hypomagnesemia will result if inflow of the magnesium into extracellular fluid is less than the outflow. Here is the mechanism of the pathogenesis of magnesium tetany. Magnesium in extracellular fluids inflow is less than outflow, then renal magnesium excretion is decreased, which results in the hypomagnesemia, and reduction in the magnesium in the cerebrospinal fluid results in the onset of the clinical symptoms like stress and release of the catecholamines. Now catecholamines causes the shift of magnesium from extracellular fluid into the intracellular fluids, which results in the severe clinical symptoms referred to as tetanus. This is the putative model of the pathogenesis of hypomagnesemia, and acronyms used: ECF refers to extracellular fluid, and CSF cerebrospinal fluid, and ICS intracellular space. Now, what is the epidemiology of magnesium tetany? Magnesium tetany is widely distributed all around the world, mainly in the northern Europe, after winter housing, Australia and New Zealand when animals enters the lush grass dominant pastures, and North America when range stock are moved into lush early pasture, or when housed stock are turned out onto such pasture in the spring seasons. Now, what are the causes of magnesium tetany? How magnesium tetany develops, or what are the predisposing factors associated with the magnesium tetany? Causes: there are several causes of the magnesium tetany related to decreased magnesium intake. It means dietary cause, just like starvation, alcohol dependence, and total parenteral nutrition might be the cause of decreased magnesium intake. Related to the redistribution of magnesium from extracellular fluid to intracellular fluid, like hungry bone syndrome, treatment of the diabetic ketoacidosis, alcohol withdrawal syndrome, and acute pancreatitis may cause the magnesium tetany. And related to the gastrointestinal magnesium losses, there might result in the magnesium tetany, like in diarrhea, vomiting, gastrointestinal fistulas and ostomies. Hypomagnesemia with secondary hypocalcemia may result in the loss of the magnesium, which leads to the magnesium tetany. Related to the renal magnesium losses, like Gait syndrome, classic Bartter syndrome, type 3 Bartter syndrome, and familial hypomagnesemia with hypercalciuria and nephrocalcinosis. Other drugs may predispose to the magnesium tetany includes use of the diuretics, antimicrobials, chemotherapeutics, and immunosuppressants may influence the magnesium tetany. Other causes of the magnesium tetany development in animals might be hypercalcemia, chronic metabolic acidosis, volume expansion, primary hyperaldosteronism, recovery phase of acute tubular necrosis, and post-obstructive diuresis. Now, what is the treatment of the magnesium tetany? Treatment in the affected animals should be left in pasture and not forced to come back to stall, because excitation can darken the prognosis even after adequate treatment. Mixed calcium and magnesium injections are mostly recommended, and subcutaneous injection of magnesium sulfate may overcome the magnesium tetany in early stage And what is the prophylaxis or prevention of the magnesium tetany? Improvement of the magnesium absorption from the intestinal tract, keeping the animal's health stable. Prevention of the sodium deficiency by providing or offering salts like sodium chloride or sodium bicarbonate with concentrates and roughages. Well-known negative interaction between potassium and magnesium could be prevented by lowering the potassium intake. Sudden increase of the ammonium should be avoided because high ammonium ion concentration transiently reduce the magnesium absorption and increase the oral magnesium intake. Thank you very much for watching my videos. Hopefully you will enjoy this, and thank you very much for your subscription and like.